Okay, now see with easily confused medications. We get confused between amiloride, amiodarone, amlodipine. Amiloride is potassium sparing diuretic. Amiodarone, it's class 3 antiarrhythmic potassium channel blocker. Amlodipine is calcium channel blocker, dihydropyridine. Then we get confused between benztropine, which is for Parkinson's disease. It is cholinergic antagonist. Benz, खोली एक मर्सिडीज बेंज से रिलेट करके वी कैन लर्न इट. Bromocriptine, also we can learn it. C and C is not going together, it's different. Bromocriptine is dopamine agonist, and it is rarely used now. Parkinson's disease. Then we have buspirone. Buspirone is for generalized anxiety disorder, partially 5-HT1A receptor agonist. GAD गैड के लिए होती है बुस्पेरॉन. फिर बुप्रोपियन किसके लिए? डिप्रेशन के लिए. मेनली स्मोकिंग सेसेशन के लिए किया जाता है. NADA रीअपटेक इनहिबिटर. नेक्स्ट है सिमेटडीन, जो कि गैस्ट्राइटिस या फिर अल्सर H2 रिसेप्टर एंटागोनिस्ट है. ये सिट्राजिन वी ऑल नो, it's a second generation antihistamine. It's given in allergy. Then we have chloramphenicol, which is 50S subunit antibiotic blocker. We have chlordiazepoxide. It is long acting benzodiazepine. Then we have chlorpromazine. It is typical antipsychotic. We have chlorpropamide. Propamide is for first generation sulfonylurea. It's diabetes mellitus, for diabetes mellitus. फिर we have chlorpheniramine. It's first generation antihistamine. Chlorthalidone. Thalidone is thiazide diuretic. We have clozapine. Clozapine is atypical antipsychotic. Clomipramine, it's tricyclic antidepressant. Clomiphene, infertility due to an ovulation. It's SERM, selective estrogen reuptake modulator in hypothalamus. We have next is clonidine. Clonidine, it's used in hypertensive urgency, ADHD disorder, also alpha 2 agonist. Then we have doxepin. Doxepin, it's again tricyclic antidepressant. Next we have doxazocin, जैसे प्राजोसिन, ऐसे doxazocin, PPH, hypertension, alpha 1 antagonist. Then for E, eplerenone, like we have amiloride potassium sparing. Here same eplerenone, it's for potassium sparing diuretic. Next we have propafenone. Propafenone is N for N, sodium channel blocker. First C antiarrhythmic. Okay. Next we have fluoxetine. Fluoxetine is depression. For depression we use fluoxetine. It is SSRI, selective serotonin reuptake inhibitor. Next we have flufenazine. It's for typical antipsychotic. Next we have mifepristone. It's for pregnancy termination, and it is progesterone receptor antagonist. Next we have misoprostol. Misoprostol is used with mifepristone and for pregnancy termination, and it is PGE1 E1 synthetic analog. F for progesterone receptor antagonist, and it is for PGE1 synthetic analog. Naloxone is given in toxicity, and it is opioid receptor antagonist. Naltrexone it prevents the relapse. फिर से जब होगा तो रिलैप्स उस वक्त अपन नाल्ट्रेक्सोन देते हैं. It's also opioid receptor antagonist. Then we have nitroprusside. It's working on CGMP, increases CGMP nitric oxide release, and it is vasodilation, then causing it is used in hypertensive emergency. Next we have nitroglycerin again CGMP increase, NO increase, anti-anginal drug. Omeprazole we all know about, PPI inhibitors, nothing new. Ketoconazole we all know, antifungal. Next is aripiprazole. Aripiprazole is A for double A, aripiprazole PPAA. D2 partial agonist. It is a typical antipsychotic. Next is anastrozole. Anastrozole is ER positive breast cancer in postmenopausal women, aromatase inhibitor. Then we have rifaximin. It is used in hepatic encephalopathy, and it decreases the aminogenic bacteria. Next we have rifampin. It is ATT drug, we know, and it inhibit what? It inhibit DNA dependent RNA polymerase. Next is sertraline. Sertraline is used in PTSD, and it is select SSRI. Sertraline. Selegiline we know about MAO-B inhibitor, and it is used in Parkinson. Then we have trazodone. Trazodone is used in insomnia. It is 5-HT2 blocker and alpha adrenergic H1 receptor. Also weakly inhibit 5-HT reuptake. Then tramadol we all have come across. We give in chronic pain, and it is weak opioid agonist. Next to Vernislin. It is for smoking cessation. Nicotine acetylcholine receptor partial agonist. And we have venlafaxine. We all know F word, and it gets through and through between our happiness, or with happiness, associated with happiness. Then we have serotonin non-epinephrine reuptake inhibitor, SNRI. Okay, so these are some of the drugs which we get easily confused with, and more or less I got personally confused between clonidine, which is hypertensive urgency, which we use in ADHD also, alpha 2 agonist. Then I get confused with the clozapine. Clozapine is a typical antipsychotic. Then I think GAD के लिए buspirone. Smoking, P for पीने वाला smoking. Okay, फिर we have Benz and cholinergic antagonist. What we have is Parkinson, benztropine, bromocriptine, all these drugs, na? And Parkinson, one more we have got it here, no? Where it is this Salicylic for MAO-B inhibitor, sertraline for PTSD. Aripiprazole also sometimes is asked. T2 agonist, partial agonist, or typical antipsychotic. Make a list of atypical antipsychotic which we confused with it now. Clozapine and atypical antipsychotic. Then we have aripiprazole, atypical antipsychotic. Then anyone more? No. So this is it. Okay. Okay, guys. We can sum this up here. Bye.